but he had his health. There's a saying that goes, "He who has health has hope, and he who has hope has everything." In a matter of weeks, he lost everything. He had a pain in his stomach that he'd been ignoring for a while, and then there was blood in his urine that he couldn't ignore anymore. He had very little support in navigating such a heavy thing at an age when these things are not yet supposed to be a weight to carry in life. In a situation like this, the collective fabric of our society should be able to step in and provide the support that he couldn't find anywhere else. But we couldn't, for so many complex reasons. And so he journeyed into the healthcare system with no advocates, no family doctor, and no warning of how much this was going to change everything about his life. Somewhere between college classes and evening shifts, he took himself to a walk-in clinic where he waited alone for hours for somebody to tell him what was wrong inside his own body. They saw him eventually for a few minutes, just enough time to order some tests, and the results that came back were not good. It was cancer. He found himself navigating complex tertiary centers in and out of specialist clinics and CT scanners. An oncologist he barely knew drew up a care plan for him. This doctor didn't have any information about Nathan beyond his test results and his diagnosis. His economic situation, his family situation, all of the fundamental pieces about his life that make him the whole person that he is. Not even a summary of the necessary information as a starting point. The doctor prescribed a drug that Nathan could not afford, and he didn't know to provide any of the supports that we do have available in our health system for situations like this, because the data that the doctor needed was not available to him when he needed it. What is a 21-year-old supposed to do in a situation like this? When you don't know what's available to you in terms of the supports in our system, and the clinicians that you trust with your health don't have the vital pieces of the puzzle to make informed care decisions. All because the healthcare system hasn't designed its data and information flows to make solutions to these problems easily accessible, not just to clinicians, but also to patients and policymakers. We haven't made the basic data available in a consumable way for all of these people to do their jobs effectively. This story is based on an experience that a friend of mine went through recently. But there are no more degrees of separation. This could easily be anybody's story. It's time for us to come together around our common goals and design a better health system for all of us. Data saves lives. Interoperability saves lives. No one in this situation wanted to create harm. No one wanted to create hardship. It happened because the right information was not available to the right person at the right time. And this is entirely fixable. We have the tools, the smarts, and the will to correct this problem in Canada.
This story is not unique to Nathan. This is happening all across Canada, where information is not available or is not available in a timely way for care providers and patients to ensure the best care management and treatment plan possible. This is our story. As a country, we have made a lot of progress in Canada on our digital health evolution. However, information on our digital health systems have to date focused on meeting clients' digitization needs and not on information sharing. Additionally, our legislative frameworks have not been set up to empower patients to manage their own information and care. Our health information systems are clogged. Some information is dribbling out, but not for everyone. This means we have fragmented health information about a patient's journey, Where necessary patient information is not available for the care teams, duplicate tests are being ordered, there is unnecessary administrative burden on care providers who want to spend time talking to patients rather than on their screens. And where there's limited health system performance measurement information within and across sectors of care. This has resulted in one of our biggest risks in our health system, and that is patient harm. Let's take a moment to look at what other industries have done to enable the flow of data between systems. For example, the banking industry. Remember, maybe some of you are so young you might not remember this, having to line up at your bank to deposit money or a check into your bank account. And you'd receive a page, a paper page with your recent transaction, and you'd put it in your little blue bank book with that hard plastic cover. And in the early days of ATM, the focus was mostly on digitizing the process of physically visiting your bank. If you're a patron of that bank at that location, you could access your account and limited information through those machines. Over time, the economic advantages of giving consumers more control over their data and easy access to their money became clear. A few banks began to allow clients to use each other's ATMs. And eventually, we arrived at a point where you could travel almost anywhere in the world and get access to your account through an ATM. This was no easy feat. Think about how much change has taken place over our lifetimes to get us to where we are today. Who in this room still remembers the days of traveler's checks? Despite these advances, many banking processes are still paper-based. While this journey is certainly, in the banking industry, is certainly inspiring, we do need to keep in mind that healthcare is immensely more complex. We're dealing with human life and emotion in our industry. These things don't always translate neatly into discrete data points, but that doesn't mean our task is impossible. CIHI and Infoway are embarking on a similar transformative journey as banks did, partnering to modernize health information flows and to work with all of you to create a connected health system in Canada. How are we going to get there? So we heard this morning from Joe, the federal government has been working with provincial and territorial jurisdictions as well as pan-Canadian organizations to overcome these challenges. Through the work to build a pan-Canadian health data strategy and the federal, provincial, territorial action plans on digital health, Canada has endorsed the shared pan-Canadian interoperability roadmap that Michael Green spoke about this morning. That roadmap creates a vision for modern and person-centric healthcare that is digitally connected and privacy protected by design. The Interoperability Roadmap is the product of extensive consultations across the country, led by Infoway and supported by CIHI, with provinces and territories, to uncover pain points and priority areas for connected care that everyone is tackling simultaneously. As pan-Canadian organizations, our two organizations specialize in connecting these dots so we can solve shared challenges together. Michael spoke about the priority areas in the roadmap this morning. Prevent data blocking and ease portability within primary care. Enable patient access to their health records. Improve provider access to patient data at the point of care through a common patient summary. And improve care coordination and collaboration through e-referral and e-consult. The first step the banks took when they decided it would be a good idea to share information across their organizations was to agree on standardized data points about people and their money. That is the work we are doing at CIHI. We're building the health data content foundation for interoperability, beginning with primary health care. This is the first building block of the Interoperability Roadmap. Banking did this too, deciding on the type of transactions clients would perform, the type of information needed, and the way the information needed to be exchanged. The breadth and scope of the health data that CIHI is defining is very broad. This is not a minimum data set for those familiar with that term. It is a comprehensive, person-centric health data content for clinicians, patients and their families who need data for clinical care planning and management, for clinics and care organizations who need data for quality improvement, program planning and resource allocation, for health system planners and decision makers who need data for health system use, health system performance measurement, pan-Canadian comparability, and for communities who need data for population and public health. This broad scope is a novel approach for Canada. We're beginning with primary care, but the end goal is to define the underlying data across healthcare sectors such as acute care, long-term care, etc. This means that the information from your hospital stay will be available to your primary care doctor to help you with your post-hospital care without you having to repeat your story over and over again. The health data content and the associated data structure are packaged into what Abby referred to this morning as the Pan-Canadian Health Data Content Framework. It is technology agnostic. So it is not FHIR, it is technology agnostic. It can work with FHIR. It defines the health data in a standardized way. It provides the data architecture for building person-centric digital tools, physical data models, and in database development. And it enables the building of use case-driven exchange standards, and that is the input into the work that Infoway is building. This framework essentially provides the recipe book for the content and structure of the data for jurisdictions and IT vendors when updating digital solutions or building new ones. Back one. Oh, there was a blank page here. In defining the underlying data foundation, we're not starting with a blank slate. That blank one seemed to have been removed. Somebody didn't get the pun. We're leveraging what other countries have done and how they've defined the underlying health data foundation. We are learning from their journeys, what worked and what didn't. Some of the countries we've looked at include the US, so US CDI, many of you will know about that, the UK, Denmark, and Australia. Our broader and more detailed approach to defining the health data foundation addresses some of the lumps and bumps, It's a lot of talking. Our broader and more detailed approach to defining the health data foundation addresses some of the lumps and bumps that these countries have shared with us, with the goal of enabling better support to digital solution providers. We also have a huge advantage in Canada by leveraging the many efforts already underway across our provinces and territories to define health data and its structure for interoperability. We aim to elevate local and jurisdictional standards to a pan-Canadian level. CIHI and Infoway are building the foundation of a connected system, but we need your partnership to make it an approachable and sustainable reality. We are working with a broad group of stakeholders as they each bring a different perspective to the information needs and the underlying data.
The beauty of live presentations. I gotta say, when I was asked a couple of weeks ago whether I wanted to participate in this panel that's going to talk a little bit about the problem that the roadmap is trying to solve and what are the relevant steps that we're going to do and how does it solve those problems, I absolutely jumped on the opportunity. But I have to say, reflecting on the previous speakers, they basically did half of the job that I wanted to do here today. So please bear with me when I will reiterate some of the core problems that we're currently trying to solve in the roadmap. And I will try to build the story in such a way that it's in simple, factual manner, showing us what's broken and how we can fix it. We hope that the roadmap will totally support that. So as Anne was mentioning, there's serious efforts underway to create a properly organized, patient-centric data model that is going to serve us throughout the healthcare system, and it's not going to be patchwork that's only focused in one area or another. So we decided to continue a little bit the banking analogy because everybody relates to it so neatly, and it was one of the biggest criticisms that was laid on healthcare, that why can healthcare not be like banking? So when we were looking at banking, yes, you may have multiple accounts. You may have different types of investments that you are doing. You may even have accounts in different institutions, but when you're talking about your own portfolio, you usually have a bank card that will represent who you are. You know that you go to a bank, even if it has multiple branches, it's the same institution, and you're able to start accessing your information and manage your portfolio that way. When you contrast that with healthcare, and this is unfortunately painfully driven home through the previous example, is a very distributed adventure. Most of patients in today's society end up seeing specialists, have a primary healthcare provider if they're lucky. They see acute settings when things don't go very well. They do lab results. They have episodes in a complete variety of settings. And all those settings are very specific in terms of knowledge, in terms of the data that they contain, what that means. And so clinical data cannot be compared to financial data. It's significantly more complicated. To make matters worse, because of this distributed nature of data, you're going to end up having your data spread across the continuum of care. So when you're doing that, suddenly you realize that the system that your primary care physician is using or your specialist at the hospital is using are built by completely different vendors. Sometimes they're built even with different technology according to different standards, and we end up in the nightmare that we've seen in the previous presentation. So what is it that we have to do? So we absolutely, first of all, need to unambiguously and unequivocally be able to present the data, to convert the data to be patient-focused. You need to be able to find every single piece of your digital health record throughout the continuum of space, need to be able to tie it back to the patient, need to start creating the concept of the digital card, just like you have with banking, have it for healthcare. Know that if you have this account, it will find your data regardless of where it is. Second, because the data is distributed in a variety of systems, and we have seen the insanity of this, even people that are willing sometimes are not entirely sure that they can share their information. You end up in situations where systems need to talk to one another, but they don't know what their rights and responsibilities are. There's a variety of legislation in the country. There's a variety of local policies. Think about the kids and their care providers. It's not the same legislation in one jurisdiction as it is in the other, and that's fine. But you have to be able to predictably know who has the right to access your data and in what capacity. So how are we going to do that? The roadmap specified a so-called trust framework that needs to be there and is the rules of the road. This is the rules of engagement. We have to know how are we going to share information with one another and what responsibilities does that come with. So let's say we do have this, and now finally service providers are able to start sharing information. How are you going to know? What information do you have access to that it is you or your care providers that are accessing the information? You need to come up with the concept of a digital identity. You cannot possibly progress in this day and age without having the capability to 100% uniquely identify yourself with high level of assurance, certainty, so that you know that if you're trying to access your information, it's you, you're doing it on behalf of your kids, or if you actually want to share that information with your care providers, then that becomes a possibility. So as you're starting to expand and you're starting to look at your care network, you're going to start seeing that more and more of those that are providing care need to be able to seamlessly access your information. So if you have the concept of a digital consent, if you have the concept of a policy, a digital policy implementation as a safeguard to your data, you have to have the capability to talk about this as a gated access framework, so that you have the technology, you have the data standardization, and you have the roles and responsibilities for people to start connecting to all this. So when we're looking at this, you would probably shake your head that, wow, this is complicated. Like I'm probably dizzying most of you when I'm talking about these as problems. Yes, there are problems and they can be solved for. And we don't need to wait until everything is solved. What I wanted to share with you today is that there's already 2 initiatives that some of previous speakers have mentioned. Patient summaries and e-referral e-consult frameworks are being put in place as we speak. These will be snippets of the important relevant information that clinical specialists and custodians have about you as a patient. They will give you the ability to actually share it with other service providers before the entire network starts coming to life. And we can literally jumpstart this using international patient summary specifications, bringing us into the world and opening up the possibility for vendors that are international to still bring their solutions to Canada and not have to reinvent this. Similarly, with e-referrals, everything is going digital, but it doesn't need to mean that you're digitizing paper trails. You have the opportunity to think outside the box, to start creating pathways that take advantage of the fact that you have smarter and smarter capabilities. And at least in a number of jurisdictions, pan-Canadian standards are being created now to be adopted for e-referral e-consult. So then, when we put it all together, we know that we have a couple of foundational things to fix. There's a good reason for doing that. We're diligently at work doing that. It will take a village to raise the specifications. In the meantime, you do have patient summaries and e-referrals. You also have a number of digital capabilities that are listed on your screen, and more are described in the roadmap. And we're hoping that when you put this under the umbrella of the previous programs and the collaboration and the communication and the work together with the appropriate authorities and engaged leaders, we are going to be able to change the narrative and bring us a little bit closer to a solution to this. So I would hope that with a little bit of this, I can turn it back to Anne to see how would this actually influence the current situation that we started with today.
It's time to envision and build a better healthcare system supported by data and digital tools that will provide holistic, compassionate, and connected care. We must come together to ensure we don't leave anybody behind. We must strive for a world in which Nathan's transitions across the various healthcare settings he visited are seamless, where the clinicians he interacted with had the data they required to provide him with the personalized care he needed, and where he not only had access to his data, but the savvy to understand that data and advocate for his own health, which he absolutely would have done, so he could finish his schooling and be a role model for his siblings, and so he could contribute to the progress of our country in all the ways he so desperately wanted to. This is about humanizing healthcare again, taking the noise out of clinicians' days so they can practice the science and art of medicine in the way that they were trained to, in the way that helps their patients live the healthiest lives they can. This is by no means an easy journey, but with all of us working together towards one singular goal, we are going to achieve connected care in Canada.